Hey everyone, it's Michael here with HomeHealthSuccessAcademy.com and 10xPatientReferrals.com. And in this video, we're going to be talking about the best places to get referrals for your agency, whether you're a home health, your home care, or a hospice agency. All right, so it's one of the biggest questions. We always get asked, hey Michael, where do we go? Hey Michael, what should we do here? So let's go ahead and answer those questions. Now listen, everybody's going to actually say this, right? We know it's the hospitals, we know it's the SNF units, we know it's the doctors, we know it's so-and-so, but let's just break it down everything for you guys right now a little bit more, right? So when you're going after hospitals, right, which is probably the best referral source because they have a lot of people going through them, right? It's just, that thing where people are getting sick, they go to the hospitals and then they go out. But how do you guys actually jump in to these facilities, right? So, it is a process, and, we actually detailed that even further in our training at our 10xPatientReferrals.com website. But in hospitals, yes, it's the best place to go to, but it's also the hardest. And the reason for that is because there's a lot of red tape going on. You're going to have to go in. You're going to be able to have to go past the gatekeepers, right? You have to get in touch of that particular social worker, discharge planner, manager, right? The main person. And the best way to do that is this. I'm gonna give you a quick tip. I don't call on the weekdays, I call on the weekends, right? So when we tell people about cold calling, it's one of the most important things. So one of the techniques when we do cold calling is we're gonna go after just to be able to get the name, right? Because the last thing you wanna do is not have a name. So we'll call on the weekend and speak to a social worker in the weekend and then say, hey, who do I speak to during the weekday? Who's the manager? And more likely they'll give you that person's name, that person's email, that person's direct number if possible. And so then you can contact them directly on a regular phone call because now you have their name, okay? So hospitals are a great place, but it takes a longer time because once you're able to get a hold of that, then they're gonna have to probably potentially schedule you for you to be able to come in to do a presentation, right? Because you have to do a presentation in front of their whole team, and they have to agree that they want to be able to work with you. It's very rare that the first time you contact them, they're going to start referring to you. Okay, so hospitals, are great referral sources, but if you're starting off in this business, right, you want to be able to go with the faster turnaround times. And the hospitals, honestly, is someplace that should be what they call a side job, meaning that you want to go after them, you don't want to forget them, but go after the ones that are a lot faster and easier, which is just lesser steps on marketing. The next one is your skilled nursing facilities. Great facilities, great places. Those are your, nursing homes, as they say. They both have the short-term and the long-term care. Short-term is typically the post-hospitalization, Medicare units, and the long-term is the Medicaid and longer-term private insurances. So, you want to be able to get into these facilities, and because they do have a lot of referrals, both for non-medical and for medical and even for hospice. And so when you're going after them, you're not going to go after the administrator, the DON, but you're going to go after the social worker and discharge planner, right? They're the ones who really makes the decision, right? A lot of people sometimes will market to the administrator and DON. Those people really don't make that decision. The administrator handles the business aspect of the whole company. The DON handles any patients that is within the facility. So her job is to, take care of the patient the moment they're admitted and to be able to get them to come home as soon as possible or to transfer into their long-term care unit. Now, doctors are also great sources for both medical, non-medical, and hospice. But you have to understand is that you have to be more vigilant on finding out what type of physician are they, right? Because the last thing is you want is you go after a family practitioner, but then all of a sudden you find out that family practitioner deals more with, younger adults, dealing more with, pediatric patients, right? Because they're a general family practitioner. You want to be able to know what are their ratios in a way to be able to know how many older people are they doing, are they working with? And so, typically like something like this, back in the days, we unfortunately really had to do it and, dig deeper and ask the right questions. But nowadays, we spend only a few $1,000s a year and we actually use a software where we can actually figure out how many home health patients has this doctor referred to within the past month, past quarter, past year, right? So that's such an amazing, information we can gather, right? And there are softwares like that allows you to be able to figure that out. And it also works for both, you can use that software for the physicians, for nursing facilities, nursing homes, and also for hospitals, right? And this software that we use also tells us who are the top, 10 home health agencies that this doctor is referring to. who is the top 10 home health agencies that nursing homes are referring to. It allows us to be able to do what we call a competitive matrix to figure out what our competitions are doing, what are they ranking, and how are they presenting themselves. Okay, so that's great also. But in the physician's offices, you're not really going to market to the physician, but to the office manager. And yes, the office manager may say, well, the doctor makes the orders and makes a decision. Hey, listen, I completely agree with that. The doctor will say that the patient needs home health services, but he's not the one who's going to be calling for the home health services. He's going to give it to the office manager or the receptionist to call that agency. So your goal is to, yes, maybe present to the physician eventually, but the main goal is to actually make that person who refers to agencies like you guys and know who your company is, all right? So ALFs, your assisted living facilities, you're not going after the administrator. You're actually going to be going after the wellness director or the RN manager or the nursing manager, because these are the ones that refers for medical services outside. They're even also the ones that refers for non-medical private duty companies, right? Now, some ALFs unfortunately do have their in-house caregiving or in-house caregivers. A lot of ALF facilities are doing this nowadays. And so you want to be mindful about that. So sometimes if you're, let's say, for example, a non-medical caregiving company, a private duty, you might actually make extra money providing staffing when they need help. So that's an additional revenue stream that you can actually have and put together in your company. Now, there's other companies other than assisted living facilities that are coming up, like, for example, called memory care facilities, or you might even have condo facilities that are 55 plus senior communities. So those are also places that you want to kind of put yourself into and provide some education and some marketing campaigns within those companies. Now, I'm also going to share with you guys one of my favorite sources right now of referral sources, and that is through using Facebook, right? So a lot of you guys, if you don't have a Facebook business page yet, you should definitely create one. But when we actually have a Facebook business page, we don't just rely on what they call organic reach, meaning that we're hoping people will look for us in Facebook, because that's not seriously what goes on in Facebook, right? People just want to look into the feed. So our job is to kind of have an interruption and put ourselves in the feed, right? So we'll actually spend some marketing, and we actually go through a whole Facebook marketing training that's located at our 10xpatientreferrals.com website. It's part of our membership program, and it has over 2 hours of training on what we do in Facebook. But to summarize things up is that we will go through the ads manager, we'll put some postings, and we'll detail our targets. We're not going to be able to do an advertising through anybody or whatever age they are in Facebook. Our goal is to hit a certain area that we're in at a certain age demographics and what they're looking for and their interests are, and then pay the money to just put the marketing in front of them, meaning it's going to go directly into their feed. So if you probably have Facebook right now and you're going through Facebook, you probably see some ads that are being placed in your feed, right? And when you're scrolling down, you're going to see an ad that shows up sometimes. And that's what we're kind of doing, is that we're making sure that we put our ads in front of the people that we want to be able to target. So Facebook has been really helping us brand our company. In addition to what we do also with Facebook is that we can actually tell Facebook that, hey, if somebody watched this ad, right, and they watch this video and they watch a minimum of, let's say, 5 minutes of this video or 2 minutes of this video, or we can say 50%, 30%, we want you to then to retarget them with another video. So we'll do some video ads in Facebook, for example, and if they watch the video, right, and they saw maybe 25% of it, all of a sudden they're going to receive another video later on and say, hey, we know you watched our first video.
We continue on to the video, just need to be able to take a few seconds of your time. And so we want to be able to ask you a question. Are you looking to gain more referrals for your agency, your home health, your home care, your hospice agency? Are you wanting to be able to find out the best sources of information to be able to get you everything you need to create a successful marketing campaign for your agency? We want you to be able to join us at our online marketing bootcamp that has over 7.5 hours of training. When you actually watch our bootcamp and join our online marketing bootcamp training, you're going to get a free month access to our 10xpatientreferrals.com. So sign up for a limited time at 10xpatientreferrals.com and enjoy all the content. So let's go ahead and get back to the video that you're currently watching.
We want to be able to tell you guys about our company. And so you need to be able to start looking about branding your company and going through where people are at this very moment. The moment that we're making this video, for example, is during the whole COVID-19 epidemic. So, I don't know if you can watch this video at this very moment, or you might watch this video maybe 2 years from now, 3 years from now. And so, because the fact that we're actually doing Facebook marketing even before, all this problems happened, we're still getting in front of the people that we want to be able to get to. we're still getting in front of the people that needs help. And so you need to be able to kind of figure out what are you doing that makes you stand out. Another one that can be used is through Google pay-per-clicks or Google PPCs. And this one right here, unfortunately, costs more money. It used to be very cheap. We were talking about maybe 10 years ago, 10 cents, 25 cents a click. Now the pricing, unfortunately, has gone up to about $7 when you're just looking up home care keywords. And so, yeah, it costs more. So you're going to be spending more money for these clicks, but are they working? Of course they are. But that's where your Google pay-per-clicks strategy has to be more robust and better, right? You can't just have them go into your web page and that's it, right? So there's processes that actually happen to that. So like right now, Facebook, the cost for Facebook ads was Google ads 10, 15 years ago. So 10 years from now, Facebook ads are going to be more expensive. So this is just something that you have to understand and figure out. Another one that we're using a lot is Google, is through geofencing, is what they may say. And so geofencing just pretty much, takes into consideration the whole Google Maps. It's really complicated. And the truth is, I'll be honest with you guys, this is a service that we don't offer yet. Like we do Google pay-per-clicks for a lot of our clients. We do Facebook marketing for a lot of our clients, but we're not doing geofencing yet. But we're starting to see a really good return in this. There's several companies out there that's doing this in the market. And, it's working well for my companies right now. We don't want to offer these services if we don't, really see it. So we always want to try things out. And so this company right now is using our geofencing. Pretty much the way geofencing works is we can say, for example, we can put a fence, for example, around, virtually when we do the marketing, virtually around, let's say, for example, a hospital. And we can literally say, whoever enters this hospital at this moment in time will then see our advertisements. Have you ever gone through your, through websites and then all of a sudden there's an advertising there that kind of, you're saying wait, I actually just came from that facility, or I just came from that business. That's weird. Or I came to a business that's similar to that. So a good example is, geofencing right now is being targeted and used a lot by a lot of restaurant chains and also by a lot of car dealerships. So a car dealership, for example, here's a concept. Is, let's say, for example, they're Toyota and their biggest competitors are Nissan, right? And so what they'll do is if they'll put a geofence around the local Nissan dealerships, right? And they say, whoever enters a Nissan dealership, I want you to target them with this ad. So all of a sudden, when they go to your screen, they're going to see an advertising saying, we know that you actually looked into Toyota, a Nissan dealership at this very moment. If you're interested about buying a car, have you ever seen a Toyota before? Or have you ever looked at Toyota? And so those are little tactics that they're doing right now. And even a lot of restaurants are doing it. So, let's say, for example, I'm a Tex-Mex restaurant, and I'm opening up. I'm going to target all the local Tex-Mex restaurants or Mexican restaurants in my area and say, when they walk into, for example, ABC Tex-Mex restaurant, I'm going to hit them with a marketing saying, hey, if you love this type of food, you should check out our restaurant that just opened up. So I just want to be able to give you guys a pinpoint of how it's being used in other industries. And that's the thing that we do in our industry. So we always look at outside trends and how can we actually apply it into our business. So geofencing is another great way to kind of look into different marketing strategies on how to get a lot of referrals. But Facebook right now is getting us a lot of referrals because we're really working hard with it. Within Facebook, for example, there's what they call Facebook pixels. Just think of it as cookies or breadcrumbs, whatever you want to call it. And what we do is that if we, let's say, for example, get somebody to our website. So we do a lot of email marketing. And so if somebody goes to our email, clicks into one of our websites, in our websites, we'll put what we call pixels or, a Facebook pixel, meaning that, right there alone, to summarize it up, when they go to Facebook, they're now going to see our marketing in front of Facebook. So it's just little tips, tricks, and strategies that you should be doing. It should not be just, walking in cold, walk-in marketing that's going to get you referrals. You have to be able to look at the whole concept of things of what you're doing. You have to be doing multiple different things for your company to be able to succeed. And, what are you doing right now for your marketing strategies? Especially during the COVID-19, everything got shut down. Nobody can go in anywhere. Are you taking advantage of different ways on how to get referrals, right? And so that's what I want to be able to share with you guys are tactics that we're using and even other agencies are using right now that if you're not yet, you should really look into. And if you want to be able to talk in further details about these things, please give us a call. Another one that really should be implemented by your company right now is called SEO, or search engine optimizations. If your website is just a virtual brochure of what your brochure looks like, then you're going to fail eventually. The goal with SEO is, and there's no such thing as, somebody working with SEO on you. You might get a phone call like this coming from India or coming from another country, Russia or wherever. They're saying that they can get you in front of Google, within a month. That's a total lie. SEO takes about a year of investment, right? So for us, for example, in our SEO services, we spend thousands of dollars, about $1,000 a month, in the beginning of the process to get us into the front page of Google. And so this is where when people are searching for home health or home care services, they're going to go to Google and do a search sometimes. And whoever really shows up in the first page, second page, are the ones that more likely is going to get the call. So we provide SEO services for a lot of home health agencies. And the goal is to find out where your ranking is. I mean, if we search your company right now, we say, let's say for example, you're in, Houston, Texas, and you put, home care in Houston, and you look up your company. Is it in the first page, second page, third page, fourth page, fifth page? If it's nowhere to be found in the first 10 pages, hey, if it's not found in the first 3 pages, you already have problems. So the goal is to be able to move you up in front, and that takes time. It takes a lot of writing, a lot of coding into your website. But guess what? If you take time, if you start now, and then let's say in a year and a half of these investments, you're now on the front page. It just takes minimum work and lesser investment to keep it in the front page than to bring it up there. But once we get you up there, the goal there is you're going to get free calls, right? Because people are using Google for that. And typically, like I said, it's the first page that's going to get you the referrals, first and second page. If you're in the third page, you might as well not be playing around with Google. Now, some of you guys are going to say, well, Michael, when I search our company, it shows up in the first page. That's because you're searching it by the name. But if you search it by the keyword of what your company is and the area, is it showing up? And that's the main goal when it comes to SEO. And it does take time. And so you don't want to wait later and say, I want to do SEO. You should actually do SEO, search engine optimizations, onto your website at this very moment, okay? Now let's talk about a little more that you guys can do, that you can find referrals from, and that is through funeral homes, insurance companies, those guys that sell life insurances, and at the same time is those day senior centers, right? So these are great places to be able to link up with. You want to be able to create power partners within these organizations in order to be able to get them to want to be able to refer people to you guys as well. So these are some of the best referral sources for you guys. I truly hope that this actually helped you guys. If you like this video, don't forget to click like on the video. Don't forget to subscribe to our channel. At the very same time, click the bell. It's really fast. It's going to be able to notify you when new videos are popping up. We truly appreciate any comments that you guys be able to have. We want to be able to answer your questions. Don't forget, go to 10xpatientreferrals.com. It has everything that you need to be able to create and learn how to market your home care, your hospice, or your home health agency. We want to be able to have you join us in our membership site. Like I said, 10xpatientreferrals.com. Don't forget. Thank you so much. Always understand that marketing is 100% of your profit, and marketing is easy when you know what you're doing.
Hey everyone, we want to be able to invite you to our 10xpatientreferrals.com, where we have our online Home Health Marketing Academy that's going to be able to help either a home health, home care, or hospice agency increase referrals, increase their census, and create a profitable company. Now, at this very moment, you're going to have access to these information through these training, marketing to physicians, how to get to hospitals, how to be able to get into nursing homes, and much, much more at a month-to-month basis with no contracts needed. It's just month to month. Now, guess what? We are offering you guys for a limited time 50% off any one of our plans. Just choose which one is going to be able to work better for you. So just stop by the 10xpatientreferrals.com at any given moment. So these are the plans that are available, whether it's the gold, the silver, or the platinum plan. Most people go for the gold plan, but it's up to you what's going to work for you. We definitely want to be able to have you come in and work with us. So here's 2 choices. Go to 10xpatientreferrals.com or click the link down below. Take advantage of this right now at this very moment and sign up with us.